My name is Melanie Franks, and basically I was really having problems with my legs because I'm a chef. So they were just like swelling, I had pain, and I've been cooking for 7 years, so I decided to come in, and luckily I picked the right place. I came in to see Dr. Keaton, and basically I'm super scared of needles, like really scared. And I got the EVLT treatment, and everyone was so comforting for me, like over the top. So I really appreciated that. Like, so if you're scared of needles like I am, they really, made sure that I was comfortable, and it wasn't that bad in the end. Basically, you're pretty numb anyways. Your legs get wrapped up, and I was able to work that day, so it wasn't that bad at all. I would recommend definitely seeing Dr. Keaton because they take care of the customers. They treat you like a person. I'm very scared of needles, and it was even like written on my chart when I came in. So everyone was just like, and I don't even want to see them, and they also know that too. So they remembered each visit I went that they knew that already. I didn't have to like remind them. Yeah, so I totally recommend it. I had no problems either. It was a very comfortable experience. It's a lot. It's the actual procedure doesn't take that long. It's like maybe 10 minutes top. It takes longer to actually like prep you for the procedure than to actually do it. After it's done, you're able to work, and the process for healing, you'll have like slight bruising and stuff like that, but you're able to just go about your regular life. You won't be able to run maybe for like 4 weeks or something like that, but other than that, it's basically you're able to like proceed with how you have your regular activities.
Water covers over 70% of the Earth's surface and is vital for all known forms of life. The rivers and lakes provide water to the fields and gardens. In the human body, the circulation is vital for all the organs and systems. The prevailing majority of serious diseases are those affecting our circulatory system. One of the most common pathological conditions of the circulatory system is a disease called venous insufficiency. It affects over 80 million people in the United States alone. Studies also show that, in one form or another, it affects almost 60% of women over 60 years of age. The most common complications of venous insufficiency include trophic ulcers, thrombophlebitis, or formation of potentially dangerous blood clots, bleeding from ruptured veins, development of swelling, also called edema, and different types of infection. Contractions of the heart propel the fresh or oxygenated blood through the blood vessels called arteries. A different type of blood vessels called veins bring the used or deoxygenated blood back to the heart. It is easy for our arteries to bring the blood downstream to the legs and feet. It is, however, much harder for our veins to deliver it back up against forces of gravity and with no assistance from the heart. To resolve this problem, we are built in a way that our leg veins outnumber significantly the arteries of the legs. Besides, each vein contains hundreds of tiny valves allowing the blood to flow in only one direction, upwards, without letting this blood to go downwards with the forces of gravity. It is well known that venous insufficiency develops due to a combination of two factors. The first one is the presence of hereditary predisposition, affecting elasticity of the venous wall. The second factor includes certain external, usually chronic conditions, causing elevation of intravenous pressure. Activities requiring prolonged standing or habitual heavy lifting, obesity, and multiple pregnancies are just some of these factors. Due to mentioned factors, veins eventually become wider, creating gaps between leaflets of their valves. The blood in such veins, therefore, moves downstream instead of going upstream. As venous insufficiency progresses, the downward flow of the blood builds up pressure in the affected veins. This pressure dilates these veins, allowing even more blood to go down, which increases the pressure further. As the veins stretch across, they also stretch along, becoming not only wider, but also longer. This is why people affected by venous insufficiency develop varicose veins, large, bulging, tortuous veins on their legs and feet. There are numerous serious complications of venous insufficiency. The most common ones include edema or swelling, trophic ulcers, different types of infection, bleeding from ruptured veins, and formation of dangerous blood clots, known as thrombophlebitis. The most common symptoms of venous insufficiency are the following: slowly developing heaviness and tiredness, as well as weakness in the legs, affecting ability to walk and, even more so, the ability to stand. Often, different types of discomfort, like alternating deep dull aches, is reported by people suffering from venous insufficiency at the early stages of the disease. Muscle cramps, also known as spasms or Charley horses, are another one of the early symptoms, as well as a condition called restless leg syndrome. Enlarged bulging veins or small tortuous bluish veins, known as varicose veins and spider veins correspondingly, are yet another symptom of the disease. As the disease progresses, swelling, numbness, perception of coldness or burning, as well as many other ones, join the clinical picture. There are different mechanisms responsible for the development of different symptoms of venous insufficiency and its complications. Swelling or edema, for example, forms due to the following. Under high pressure, the wider the affected veins are, the thinner their walls will be. The thin venous walls allow the water contained in the blood to leak into the surrounding tissue. Accumulation of free water in between the cells of the soft tissues of the surrounding veins is called edema. Additionally, the blood leaking downstream is the used blood. It contains no oxygen, a significant amount of carbon dioxide, lactic acid, and other so-called end products of our metabolism. Under these circumstances, our tissues undergo so-called trophic changes, with eventual development of complications, including trophic ulcers, thrombophlebitis, bleeding, infections, swelling, and even malignant degeneration, development of skin cancer. Another common complication of venous insufficiency is called thrombophlebitis. It occurs when the already turbulent flow in the unevenly enlarged veins leads to the development of the stagnant areas, where the blood becomes almost motionless and, therefore, prone to formation of blood clots. This very rare video recording captures an enlarged vein, as it is seen on duplex ultrasound during the development of thrombophlebitis. The decelerating individual particles of the blood can be seen just prior to their precipitation and formation of a blood clot. The larger the varicose veins, the thinner their walls, the higher the pressure of the blood inside these veins, and the more likely they are to rupture and to cause bleeding. Under the pressure, affected veins stretch in all directions, becoming wider and longer. Such enlarged, bulging, tortuous veins are called varicose veins, or varicosities. Commonly perceived as a disease, varicose veins are, however, just a symptom of venous insufficiency. The identical process in the smaller veins, also called venules or venous capillaries, leads to development of the spider veins, also known as telangiectasia. Usually spider veins do not cause any trouble or remain asymptomatic. Occasionally, however, just like varicose veins do, spider veins too can rupture and cause significant bleeding. When enlarged to an extreme degree, these spider veins are called veno-venous malformations. Due to substantial risk of bleeding, it is mandatory to treat such lesions as soon as they are discovered or have developed. Edema of venous insufficiency, being often wrongly perceived as edema related to congestive heart failure or renal insufficiency, and is incorrectly being treated as such with, for example, diuretics or water pills. Diuretics are, however, contraindicated, since the edema of venous insufficiency is caused not by increased water retention, but rather by the abnormal distribution of this water in the body. As venous insufficiency progresses, not only does the water leak into the tissues causing swelling, but also the blood cells escape through overstretched walls of the affected veins. Hemoglobin released from the trapped blood cells gives the skin its brown discoloration, so typical for advanced stages of the disease. With the development of swelling, significant amounts of stagnant fluid accumulates in the soft tissue surrounding the affected veins. Retained fluid contains highly concentrated N metabolites of physiological degradation and therefore readily attracts bacteria, leading to the development of infection. Under the above circumstances, a smallest lesion of the skin over the affected veins can lead to development of a trophic ulcer due to, first, increased amount of fluid coming through the wound, and second, due to abnormal nutrition of the tissue responsible for healing. An ulcer untreated for prolonged time is likely to undergo malignant degeneration, in other words, to turn into cancer. Venous insufficiency is a group of slowly developing, serious diseases with potentially devastating complications. Fortunately, achievements in contemporary medicine and technology made it possible to successfully treat and often cure venous insufficiency. Early diagnosis and aggressive treatment are the key factors to success of such treatment.
I'm a teacher, so I've basically been standing for 25 straight years, and I probably also have like a genetic predisposition to have varicose veins, because I have relatives who have them. And I didn't care in the beginning until things started to hurt, and things were hurting in places where I couldn't see anything. So I looked up things online, and it seemed like when your valves start to fail, you do start to get a lot of pain, even if you don't see like those classic swirly things on the outsides of your legs. And I went to another place first and got evaluated, because I looked them up online and they like teachers there. So but they wanted to strip the vein, and when I looked up things on the internet, it sounded like that wasn't a solution. It was going to be temporary, painful, and leave a scar, which sounded like a really bad idea. So I put it off until I was in ridiculous amounts of pain. I waited too long, and by this time now they were in both legs, two complete failed veins in both legs. And you always want to find somebody who's good, so I was looking for who's really good, who's got a good reputation, who's got a lot of different things that they know about this, not just, he was involved in cardiac surgery as well, so you figure if someone trusts him on veins in their heart, maybe my legs are okay. And he was also doing the ablation, which seemed to be the most modern and the best thing that was a permanent solution. So here I am. It was much easier than I thought it was going to be. When you read about it, it looks very scary, that they're going to thread something from your ankle all the way to your crotch and then use a laser to seal this vein off. But as they're going, they're giving you the shots of the anesthetic, and discomfort, yes, but no more than when you go have a filling at the dentist, and I would say not even as much. And afterwards, yeah, there's a couple days that are not so much fun. But if you keep your legs up, if you have to sit for a long time, if you make sure that you're moving when you're standing, it wasn't that bad. I really used just Tylenol, because I was on an naproxen sodium, so I didn't want to use Advil. And other than that, it's been pretty painless. I was up and walking around. I came here in the evening, went to work the next day, went to work every day that week. 4 days later, had the other leg done. Went back to work the next day. I didn't miss a day of work, which is pretty amazing to have something done in your legs and go back to a job where you have to stand. So that's pretty cool.
Do your legs feel achy or heavy? Become tired easily or swollen? Is it difficult for you to stand or walk? Do you suffer from muscle cramps or restless legs? You could have an advanced vein disease with no visible bulging veins, just like over 80 million Americans do. 60% of women in their 60s have vein disorders. Only some of them have visible varicose and spider veins. For some others, horrific complications such as blood clots, bleeding, infection, and ulcers serve as a first sign of the problem. All procedures are non-invasive or performed through a needle and are being done right in the office within 30 minutes. Safe, painless, and with no downtime required. What's most important is the results are permanent. The varicose and spider veins are never a disease, but rather a symptom of a disease. The goal, therefore, is to identify and treat the disease, which is responsible for this and all other symptoms. Due to our erect posture, the veins in our legs have to work hard against forces of gravity to bring the used deoxygenated blood back up to the heart. That is possible due to coordinated functions of hundreds of one-way valves. With venous insufficiency, some veins become so wide that their valves start leaking venous blood backwards down away from the heart. And with time, due to high venous pressure, normal veins overstretch into varicose and spider veins. More importantly, the venous blood is depleted of oxygen and rich with end metabolites such as lactic acid and free radicals, infusion of which leads to tropic ulcers, infections, bleeding, thrombophlebitis, swelling, and even skin cancer.
I was on a flight, round-trip flight to Miami on the same day. Left very early in the morning, came back late at night. Was tired, never got up, never, exercised my foot or whatever. And the next day, both of my legs swelled up. So I went to my doctor, and he immediately sent me to the hospital for, to make sure there wasn't a blood clot or anything like that, and then prescribed a diuretic for me. And after about a month of that dose of the diuretics, I went for a follow-up, and my blood pressure was 80/60. And he said, "How are you feeling?" I thought, "Are you dizzy at all?" I said, "No, I'm fine." He said, "Well, I think we better, reduce the diuretics there." And then the problem came back. So I was on this on again, off again with the diuretics, and my leg would swell up, and you get all of that attendant, it's dry, it's itchy, you scratch it, whatever. And so I thought, well, I'm going to go online and I'm going to see if I can find anything more about treatment of edema, and that's when I saw Dr. Katone's. I found his site where he said that the prescribing of diuretics for edema is contraindicated, and everything that he wrote on his site there made perfect sense to me. So I called him and set up an appointment, and I came, and he looked at me and explained to me about the venous systems, and that I have I think it's called chronic venous insufficiency, and that he had a procedure that he had, I believe, helped pioneer to take care of me. So this is my follow-up for my 4th procedure. They did they did one whole leg and one side of another one, and then they did the reverse procedure second time. So there was 4 procedures in total, and everybody's been great here. I think the staff is very professional. They see you on time. Everything is, very clean, well organized, and friendly staff, highly professional, and I would recommend Dr. Katone, sure.
Hi, my name is Michelle Dume, and I was having a lot of pain in my legs. Also, there was a lot of varicose veins, and of course I'm a young lady, like to go to the beach, so I didn't like to see them. At first it didn't bother me, but then it started to get worse, and then the pain, it was very, very painful. And I'm a nurse's aide, so I'm always on my feet all day, sometimes 16 hours a day. And I have kids, so I'm always chasing them. So the pain became more difficult to deal with after a couple months. So I went on the internet to look for a doctor that deals with that could give me more information about how to get rid of them, or how to even deal with the pain or something, just to help me out. So then I saw this website Dr. Kitan website. So called them up, make an appointment, and once I came in, the office was very nice. It was very well put together. Everyone was very nice to me, and then when I meet the doctor, he was nice as well. His assistants was very nice. They were very respectful. I didn't feel disrespected in any way, or because it's my leg, so they have to touch my leg, but it wasn't inappropriate. The procedure was easy. I was up and walking. It didn't stop me from work. I went right back to work. And then the next day, it was just a little sore, and then after that, I was back to normal. I had to wear the stockings for about 2 weeks. Still wearing them, but it feels good. The site feels good. It's just a little sore and a little scab, and then that goes away.